This is a presentation on homelessness among aging out of foster care, prepared for Sociology of Homelessness by Brianna Topps at Northern Illinois University. Many people face homelessness every year, but often the focus is on veterans and families that are facing financial hardships. There are numerous social services programs for veterans and families that help provide shelters, food, and basic needs. But there is very little research that has been done on emerging adults aging out of foster care. This is the reason why I'll be presenting research findings on aging out of foster care. According to Burzen, Rhodes, and Kirsten in 2011, inequipped housing and homelessness are significant problems that youth and young adults aging out of foster care in the United States experience more than their same age peers. Also, in Hen and Hammond and Cursor research in 1999, Congress passed the Foster Care Independence Act, requiring states to extend social services for former foster youth until the age of 21. Note that FCIA does not provide specific entitlement of funding for their services, but rather require that there be service in places which can serve this population. As a result of the FCIA, some ties to the social welfare system may remain, though the extent of support varies from state to state. For this presentation, I argue that social services lack aftercare for young adults that age out of foster care, which includes creating health insurance coverage to old age and finding a stable living situation for them. Among this, Congress readdressing the Foster Care Independence Act, allowing the act to be effective and following the funding to provide for the emerging adults. According to Hamilton and Custard, a child that has history of placing in foster care system makes the urging adult period more complicated and problematic in a variety of ways, including meeting basic needs such as housing and health. This study was with 31 former foster youth in San Francisco and Oakland in California. Their study conducted housing and health care circumstances since aging out of foster care system. The study's findings suggest that the period after leaving the foster care system presented multiple challenges for emerging adults. Housing instability threatens aspects of living, including health and healthcare access. The participants from the study suggest that foster care should allow them to stay in the foster care system longer, disseminating information about programs and services available for the former foster youth in a variety of formats. Here is a woman that suffered from a chronic stomach pain, and doctors did not feel the need to run tests. And I think they do that because of you, your medical coverage level. If you're on Medi-Cal, then they'll treat you as if, oh, you're not really important. But if you're paying for it, just, I guess, they treat you like royalty and do whatever they can do. But but if it's like you're the regular class, then they treat you as if, oh, it's just nothing. And I think that's why they would make those excuses or make up the a what to call it, a fake diagnosis when it's really not the case. In this graph from Darskin and Courtney, it shows that 2/3 of the 12% become homeless in the first 6 months after exiting. This number is increasing through the years. It will not stop until we find a way to fix it and provide more aftercare to children that age out. As you can see, it increased by a lot. According to Arnott, emerging adult is defined as district development stage occurring between the ages of 18 and 24. Arnott 2000 described the major development task emerging adults as accepting responsibility for oneself, making independent decisions, and becoming financially independent. And you have to keep in mind that many of these adults that are turning 18, they do not have the family dynamic that someone else would if they were not in foster care. So what can we do about this situation? Once again, Darcy and Courtney suggest that more should be done to encourage all the states to use their Chaffee dollars and make money from other resources to give foster youth a, an age-out housing assistance when they leave. Darcy, Darwin, and Courtney also mentioned taking advantage of federal legislation to make the foster youth eligible for housing assistance under the Department of Housing and Urban Development Family Unification Program. Government assisted transitional housing programs that come with case management and life skill training. This will help them merge into adulthood. There are a handful of programs like this that exist, for instance, Youth 360 in Naperville, in La Queso Norte in Chicago, and a few others. Unfortunately, the vast amount of youth are at that are homeless subsides the amount of these programs that are offered. So if we are able to make these programs work and find the funding for it, we will very much limited we will very much limit the amount of people, amount of children that are exiting foster care services after they're 18. Thank you.